As part of our stress recovery program, welcome to our class, Taking Down the Giant of Fear, a simple guide to healing through fearlessness. Once upon a time, a young shepherd brought down a giant. Have you ever wanted to be more fearless? People who live with less fear make more room for health, enjoyment, and productivity. A more abundant life. So, what could our lives look like without a giant bully of fear caging us in, or feeling the weight of frustration or insecurity holding us back? Did you know that 75 to 90% of all primary care visits are related to high levels of survival stress? In this class, we're calling that high level of stress simply fear. We're finding that this high level of stress impacts not only our physical body, but also our thinking, emotions, our motivation, and our spiritual well-being. As part of your healthcare team, we believe that fearing less is good medicine and a great way to prevent health problems. High frequent fear can keep our heart rate and blood sugar too high. It can weaken our immune and digestive systems and limits our ability to think clearly. Any unresolved tension of fear, like long-lasting anxiety, anger, or terror that come from our flight, fight, or freeze response to danger, can get stuck. Getting trapped in fear can cause dysfunctions that lead to physical, mental, and emotional disorders. That's why we've developed an integrated approach to conquering fear. Today, we'll introduce 3 patient teaching handouts or tools that are based on medical research, neuroscience, behavioral health, addiction medicine, and biblical spiritual care principles. For those who are our patients, these handouts are available at the clinic or online. For those of you who are simply interested in increasing your awareness of how to reduce stress, we welcome you too. Let's start with a good example of healthy fearlessness taken from spiritual care. David, whose life and thoughts are recorded in the Bible. As a young shepherd, he faced a taunting giant completely alone. Instead of using conventional weapons, he chose 5 smooth stones, tools he was already skilled in using. He harnessed the energy of fear, ran into battle, and conquered the giant. While other armed and trained soldiers were paralyzed by fear, David leaned not only on his physical readiness, but on an understanding of his enemy's weakness. Then, leaning on his communication with God for inspired strategy and strength, he became the unlikely hero his whole nation needed. We can each be, in our own way, unlikely heroes too. By learning to understand and recover from fear, we can step into greater health and confidence. Our clinic's mission is to look at health holistically, meaning that we want to respect the needs of our patients as a whole person, spirit, soul, and body. Here's a quick look at 3 patient handouts we'll be focusing on. First, Designed to Heal. It's a simplified way to understand how fear works in our bodies. Then, the Stress Scale, a tool to help us personally identify our stress level and then be able to communicate about our symptoms related to stress. Then, the Stress Recovery Personal Planner. It provides a set of practical, proven strategies to help us begin to design a plan to overcome fear, minimize stress, and recover. Our hope is to arm ourselves with hand-chosen weapons to bring our own fear down to size. Part 1, Understanding Fear. Our first two resources provide a foundation for understanding the physical and emotional experience of fear. No matter who we are, we all seem to know what stressed out means. It's a common human experience to feel uneasy, physically and emotionally, when stress gets too high. If we can express our feelings in words and connect with someone who understands, already the weight of fear can feel lighter. So let's face fear together. Just what is stress? When does stress become fear? And what forms does fear take? We can understand these things better by looking at the nervous system of our bodies, focusing on our nervous system's 3 control centers. First, without getting too technical, let's take a minute to talk about what our nervous system, stress, and fear mean when we're talking about our body's fear response. Our nervous system is what senses stress. This system creates and conducts messaging that coordinates how all of our body systems work together to stay healthy and safe. Though incredibly complex, we'll simplify it by looking at 3 basic control centers that respond to stress. Stress is the invisible tension your nervous system detects in response to what's happening inside or outside of us. That input can be both conscious, outside of us, and subconscious, internal. In other words, we react not only to things we directly observe, but also to things we sense and remember. Fear happens when stress reaches a high level, causing our sense of well-being to be disrupted by a sense of threat or danger. The body automatically shifts into a survival state we call fear, or the sympathetic nervous system. This is the system that activates the body for extra alertness and the energy it needs to handle an emergency. It's built in and immediate, bypassing rational thought to help us respond quickly to a threat or danger. Fear is like an alarm clock. It wakes us up with louder, more intense emotions, alertness, and energy to help us survive. This nervous energy is helpful in danger, but it's not designed to be our normal state. When our lives feel constantly threatened, it's like an alarm that never turns off. Ideally, once we've been alerted by a sense of danger, we can know how to turn off the alarm and redirect that awakened energy to face the day. Our first handout is called Designed to Heal. It's a very simplified way of explaining how our bodies respond to stress and how we were designed to recover when stress is high and activates our fear response. Let's quickly look at each of the 3 control centers that are designed to keep us thriving, safe, and able to recover. First, our thriving center, the rational brain, which gives us the capacity for higher functioning and thought. This is our unseen treasure chest, our prefrontal cortex, where we're designed to operate best. This allows us to make complex decisions and problem solve. Our relational skills, moral reason, creativity, and the ability to intentionally love originate from this part of our brain and nervous system. This is where we can thrive and learn best. This system within the nervous system can ideally be characterized by a sense of well-being, connection, and productivity, even on a rough day. It reflects how we are made in the image of God, unlike any other creature. Next, our survival center, the emergency response system, the alarm center we talked about. This is the sympathetic nervous system that we're calling the center of fear. When threat or danger is detected, it activates fear, our flight, fight, or freeze response. Energy and focus shifts to flight or escaping, fight or defending, and freezing, which means overwhelmed and paralyzed by fear, as a way to shut down the body for preservation. This system can quickly recover, or it can get stuck on, even after the initial sense of danger is gone. Harsh emotions like anxiety, fear, anger, rage, and terror are what we feel here. One of the reasons the system may tend to get stuck may be related to the fact that the neurochemistry of fear includes a numbing or anesthetic-like effect. While this can be really helpful in times of defense or when physical injury might occur, sometimes when the numbing agents of fear start to wear off, we may resist, subconsciously even, getting back to our rational brain to face the hard truths we need to solve problems. When we're angry, for example, we may feel more invincible than we really are and powerful. Anger is less rational and sensitive to others, but it can feel powerful. Fear diverts our body's energy and focus to temporarily increasing strength, while rational thought and other non-essential body functions slow down. Recovery is the final system. That's the recharging system, or our healing center. It's important to find our way to this system. This is our safe place where we can go to renew our strength. The parasympathetic nervous system. We'll be focusing on this system because of its importance in our health maintenance and recovery. This system is what allows our body to calm down, rest, digest, and recover. And this is where healing happens. Unlike the survival zone, recovery isn't always automatic. Often we must intentionally care for ourselves to turn off the alarm, so to speak, slow down, or just release some of our survival energy. The systems that help us process our stress, regain normal function, and recharge are controlled by this part of our nervous system. Just like a weak battery needs charging, our bodies need this system to reset and function well, especially after a time of illness, trauma, or loss. This beautifully designed system is what helps to keep us safe and healthy. In many cases, we can quickly move through these three systems without really having to think a lot about it, especially if we've learned good coping skills. But in a prolonged time of high stress or environment of high stress, we can spend too much time surviving, leading to a backup of unresolved stress. When we're not able to recover, we risk becoming depleted, depressed, and are more vulnerable to developing illness or even chronic disease. The good news is we were designed to heal. Fear doesn't have to be a giant. The stress scale. Know your own level. Our next patient handout, the stress scale, may be used by a nurse or provider when our patients are discussing their symptoms. Becoming aware of our own stress level is helpful for being self-aware and sensitive to what our body's trying to tell us. When we can clarify our level of stress and explain it, we can also make our providers aware of a bigger picture as they're trying to diagnose what might be causing our symptoms. When we're highly stressed, our mind is focused on survival, and we can become less self-aware. Checking in on our stress level, like checking on a car's oil level, can help prevent deeper problems. Physical pain, for example, helps us identify where our bodies need help. So just as we might ask our patients to describe their pain on a scale from 1 to 10, we're encouraging patients to use this scale to determine when their stress levels might be important to consider. Fear or high stress can cause a different kind of pain we call soul pain. The focus of this tool is to help identify when stress may be a health risk. High stress or fear is usually marked by the intense emotions of anxiety, fear, or anger that can then escalate to rage or terror. These levels of stress can become a health risk unless they can be resolved or minimized. If high stress is prolonged, it can deplete our stress neurochemistry. Depletion is another state that can put us at risk of developing illness unless we know how to recover in healthy ways. Our bodies register and reflect our stress. Being able to identify our emotional feelings of stress can be an important skill of emotional intelligence. By being able to capture our emotional feelings in words and knowing what our feelings tell us about what we need can be a great foundation for knowing how to take care of ourselves and knowing how to help our providers and loved ones understand us better too. We realize that sharing emotional feelings may be uncomfortable. Using this scale is optional, but if stress is affecting our health, this tool can help patients and healthcare providers work together better. Here's how it works. In the 0 zone, we're depleted. This is when our healthy stress neurochemistry is drained. We may feel emotionally numb, exhausted, or depressed. More frequent illness, forgetfulness, or a lack of motivation may occur. This is when a plan for recovery is important to consider when we find ourselves depleted. In the 1 to 3 is the recovery zone. We're resting, processing, and recovering, meaning we're able to slow down for some self-care, either because of a healthy routine or after a time of high stress, illness, or injury. 4 to 6 is that thriving zone, the state we hope to operate from most of the time, and where we're best able to be productive, mentally focused, able to regulate our emotions, and stay connected. 7 to 10 is that fear or survival zone, where we might feel anxious, easily angered, or overwhelmed. Too much time in this level of stress can be a health risk too. This level of stress may contribute to how we're feeling and explain some of our symptoms. Sadly, some of our patients report they have trouble even remembering a time of thriving or having enough time to recover. When we become severely depleted, it can lead to feeling emotionally defeated and hopeless. This level can be a significant health risk, and your provider may want to ask and understand more about how to help you recover. Since our motivation may be low even for self-care, it may be a time of needing extra support. This is when it can help to know that we're designed to heal. Minimizing high stress for even 3 days can be enough to allow our body to recover some strength emotionally and physically. Getting support, perspective from someone we trust, or sometimes a professional evaluation of our situation can also help. The first step in recovery is recognizing the need to recover. The next is knowing how. Now that we've looked at some foundations for understanding fear, it may be a good time to take a little break and gather any insights or questions you have. Maybe even check in with ourselves about what our stress level has been lately. Then when we're ready, we'll move on to part 2, planning for recovery, introducing 5 ways to fear less and thrive more. In order to help win the battle with fear, we'll consider some proven ways to keep fear from dominating our lives. Part 2.